What is that popping that I hear or that I feel, and can you hear it? And so to answer those is yes, we do hear it, and yes, we do feel it. And so the root of that is when we're moving a spine, right? We're playing with normal joint mechanics. So how your body is supposed to move. We're not creating hypermobility. We're doing exactly what the body needs. Now the noise, a lot of people will go back to it's nitrogen in the joint. That's a buildup. I think a lot of it too is the scar tissue. I think the scar tissue buildup is the joint restriction, which then has manifest into just breakdown. And so when it moves, you're getting that release. And so to go to it, nitrogen would be the specific answer, but everybody's pops or clicks will feel different or will sound different. And so just not to get too fixated on it, but that's really the root of what the sound is.
Yeah, I mean, I would agree with that. I think because you'll get, you and I talk about this all the time. You can hear and even feel like a joint move differently. So in my perception, like the louder, kind of more like authoritative pop is more of just like you said, nitrogen gas kind of like builds up in between two bones in a joint. And that release of pressure is just that noise, right? So imagine toothpaste that's been left out overnight and it kind of gets a little bit crusty and not quite hard, but it's kind of like that. You have to break it loose off the lid. So that releasement of pressure, right, is that noise inside the joint. Scar tissue has a little bit of a different noise to it, where it's a little bit not as quite as loud, but it kind of slides a little bit. Yeah, yep, and that's ripping of some scar tissue that's been there for quite a while. Yeah. Yep. So, but no, it's not bones colliding into each other. I think we get that question a lot. Like, are you banging bones against each other? It doesn't hurt. Right.
And now, if it hurts somebody, most of the time that's going to be probably where their complaint is.
I think like hurting versus was that uncomfortable? Because I think hurting would be like, okay, that's difference. It's like pain versus damage. Like somebody who
soreness.
Yeah, using the term hurt, we want to clarify with the patient. Was that? Give me some description of what that felt like, because sometimes if it hasn't been moved in quite a while, or if ever, then yeah, some soreness, right, can accompany that. So we want to clarify with patients that, like, we don't use the term hurt. It's like, what did that feel like? So and that gives us feedback. But to answer the question simply, it's usually the release of pressure within the joint capsule, joint space, or scar tissue that's being broken up.